Yes. Yeah. Good evening, Chitra. Good evening, Meera. And good evening, Blessing. So, hello and welcome to Seven Sentinels. This is Grand Master class, and today we have a special episode, and that's related to sentence structures. Yes. Yes. All right. Yes. Good evening, Vincent. Yeah. So here we start with a writing. Now let us see this. Go through this first part. Yes. We are going to study in detail Right. Now here, the format, the timing, and the stimulus materials. Yes, good evening, Neha. So these are the three areas that we are going to cover here now. Yes, good evening, Manjula. So there's only one task, we know that very clearly, and we have 45 minutes in total, that also we know. Reading time 5 minutes, writing time 40 minutes. Now this reading time, many people will not cash properly, not get that much benefit properly. So how to get that benefit is more important. Now writing time 40 minutes, so total 45 minutes. That's very clear. Okay. Now, stimulus materials. Stimulus materials. Background information on context. Set of case notes, profession specific and or relevant documentation. And then task instructions. So background information is given. Then case notes are given, set of case notes, one set of case notes according to the profession, and relevant documentation. Documents are also provided. And what instructions they are also given. Now let us see here. The year task type is a referral letter that is taken in this book. And there are 6 assessment criteria. There are 6 assessment criteria. Now let us focus on this area. So 6 assessment criteria are there. PCCGOL, we can short. We can write shortly as PCCGOL. Now marks based on this assessment area. So 7, 7, 7, 7, 7. 7 5s are 35 plus 3. So 38. Total 38 marks. 7 5s are 35 plus 3, 38 marks. You have to know how it is considered. You have to know how it is considered. So total 6 assessment criteria are there. So yesterday we have considered about purpose, content, conciseness and clarity, genre and style. Now organization and layout and language are left. That we'll see later. Right. Now go through these points. Now we are moving to the sample here. Now let us check this sample. Okay. Let us take this sample. Just to go through that one. How many times I told you many different things. Everything perfectly, it is clear here. Go through this page. Study this page, what I am showing you. Yes. Now, where do you get this information? Yeah, good evening, Anjana Yadav. I'm not talking all those things which I have already told you. I'm not going to teach. I'm just only confirming. Now let us see here, Georgine Ponsford. Then resident community nurse. Community retirement home. 103 Light Street. Then Newtown. So, this is how these things go. So step by step, everything is given there. Just don't miss these points under any circumstances. Don't miss these bits of information under any circumstances. See, regarding Lionel Ramamurthy, regarding Mr. Lionel Ramamurthy. Okay. So what is important? What is not important? Which should we not miss? All these things we are going to discuss. I'm not going to teach anything which I have already told you before. Yes, Shabnam, good evening. So, every bit of information is coming from the case notes. Only the thing is how well you are utilizing it is the point. Right. Yeah. Now this is, for example, computer based. That is, next one is computer based. So input detailed description. Okay. So that particular one is computer based, but everything is normal otherwise. So detailed description. Detailed description. Input word length. The task introduction and case notes will cover 2 pages, excluding headings, example dates, etc. Right. So forget about that computer one. Now expect input word length, expected output word length. Input word length is 2 pages. We have seen 2 pages. And then output word length, you have to write 180 to 200 words. 2 pages information is given, but you have to write in 180 to 200 words. There will be a lot of information. There will be lot of information. And that information, how well you are transforming and limiting it to 180 to 200 words is very important. So minimum word limit is 180. Maximum word limit is 200. So candidates are required to write approximately 180 to 200 words in the body of the letter, excluding salutation, subject line, and complementary clause. Body of the letter. So salutation remove, complementary clause, that is based on the aforementioned circumstances. Okay, in case any additional information is required, that is complementary clause. So salutation you remove, subject line you remove, and complementary, the closing, in case any additional information is required, that also you remove. Then after removing all these things, the words should be 180 to 200. So let us take like this. So task achievement. Task achievement. Okay, remember that it should be 180 to 200 words. Okay, other than salutation, subject line, that is regarding line, and the complementary clause. Fine. Now coming to the point here, it's very clearly saying completing the task within the word length is an important part of task achievement. Many people say, sir, we are writing more words, we are writing less words, we are not able to get this many number of words, we are not able to limit it to 200 words. All these questions don't want. The rule of the game is minimum 180 and maximum 200. Don't write less than 180. Don't write more than 200. Approximately. No need to count each and everything. Just think like that one. One line you count, how many words are there? Then number of lines you count. Finished. For example, in one line, you are writing 7 words. You can see, you can count like this. 1, 2, 3, 4, 5, 6, 7, 8, 9. But these are small. 1, 2, 3, 4, 5, 6, 7. So 7 roughly average. Into how many words are there? Lines are there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So 11 into 7, 77 words. This is approximation. Guessing how many words are there. No need to count each and every line, each and every word. Just count how many words are there in one particular line. And then how many lines are there and multiply. Roughly you can get it. That is how you have to see. So completing the task within the word length is an important part of task achievement. Yes. Your task should fit. It's a demand. It's a necessity. So if you're writing less than, that means you're not able to expand the case notes. Expand the case notes. That means expand the terms to fit and make 200 words. you're not having that much capacity to expand. That's your weakness. Next one, if you're writing more than 200 words, you're not ready to concise, brief into 200 words. That means you're writing 200. There are some students who wrote 320 words also. So, if you cannot limit to 200 words, then you are lost again. So, if considerably fewer words are written, it means that all necessary and relevant content is unlikely to have been included. That means you did not include. If you are writing 150 words or 140 words, that means all necessary and relevant content is unlikely to have been included. That means you did not include all the, you're writing 150 words, 160 words. That means you missed some relevant information. There is no doubt that. And if, however, the word count is significantly over 200 words, then irrelevant details are likely to have been incorporated, which will distract the reader and obscure the clarity of the letter. So, if you are writing 220 words, 230 words, 240 words, that means what? You have unnecessarily included the irrelevant matter also. That's what it is telling. I'm not telling. This is the official OET book for teachers. This is the official OET book for teachers, handbook for teachers. So teachers should keep in mind all these things. This is a training session for teachers actually. Okay. So this is a training book for teachers. OET teachers handbook. We can see here, teacher handbook, our best teaching advice and resources in one place. This is for teacher, not for the student. So I want you to learn all these techniques so that you will not miss. You're not just a student, you teach yourself all these things. Then if you start teaching yourself, then that is fine. This is there in the official website. You can just type teacher's handbook, OET official. You'll get it. It's open to everyone. Teachers handbook, OET official. That's it. See, teachers handbook, OET occupational English test. Finished. Just download it. Just download it. So just open link in new. Okay, open link. So just click on that one, you'll get that one. And what you have to do, you download it. So access it here. Just click on here. What's in the book? Tips for teaching in the healthcare context. This is for teachers. You can download it. You can download it. Just click on here and it will ask you your details, name, email, and other things. Then you submit form and automatically it will come into your mail address. So take it, read it, learn it, use it. So you want the link I'm giving here. Just click on that one and you can download. So, right. Okay. Yes. Now we got this point. The next, stimulus material. So what is stimulus material? Okay. Let it be so. Okay. Okay. So let us take like this. Stimulus materials. Yeah. So each writing task, you go through this page. Yeah. I'm just showing you so that you will go through these things. I'm not going to teach all these things. Okay. So you just go through these things. Okay, what you have to focus, everything will be given here. Okay. I know in spite of my telling, nobody will do that one. Preparation tips and strategies. Here there are less, even more than this I am giving you. Okay. So instead purpose of the letter, the role of the addressee, redundant information. See, I have been telling you how many times I told you redundant information, redundant information, redundant information. Okay. Planning and structuring. Okay. Preparation tips, genre of writing. So all information, assessment criteria, which I have been teaching you yesterday. Okay. So purpose, content, conciseness, clarity, genre, and organization, a layout, and language. Okay. That's it. Everything is related there. Then so it's always a good idea to encourage students to allow a couple of minutes at the end of their writing time to review their work and to check that patient details have been correctly copied, that spellings of medications, etc., match the case notes and are used consistently, that grammatical agreements of subjects with verb, choice of tense, etc., are accurate. Okay. Although the quality of candidates' handwriting is not assessed in the writing test, the quality of candidates' handwriting is not, your handwriting is not assessed. But your students should be encouraged to write legibly and to avoid too many untidy deletions, arrows to reorder information, etc., so as to avoid undue strain on the reader. Please practice in planning the structure of the letter, like deciding which points are to go in separate paragraphs will help to reduce the likelihood of deletions, etc. So all these things, if you learn, if you go through these things, it will be easy for you to follow. Okay. Now coming to the point, we're coming to the main story of the session. So sentence structures. Sentence structures. Yes. Sentence structures. Right. Now sentence structures. Okay, I'm going to give you one sentence, suppose. So one sentence, how you are going to write? For ensuring postural drainage. So this is something called postural drainage, and you have to ensure postural drainage. Okay, for ensuring postural drainage. Now, what is this postural drainage? You will get in your case notes. Now, what is this postural drainage? Let us check postural drainage, medical term. Yeah. Postural drainage is a technique that involves laying, sitting in certain positions to drain secretions from your airways using gravity. Depending on the areas of your lungs most affected by secretions, there will be certain positions that will be working best in maximizing the benefit of your airway clearance. That is called postural drainage. Cambridge University Hospitals. Okay. So that is what it is here. So this is postural drainage. So now postural drainage, this is sitting up and this is lying down. This is sitting up, this is lying down. Okay, fine. Positions, different positions. Okay. All these are different positions. Okay, now let us see. For ensuring postural drainage, sitting up instead of or sitting up rather than lying down. Okay, sitting up rather than lying down. Okay, is recommended. So this sentence can be written in many different ways. This sentence can be written in many different ways. So let us take some sentences. For ensuring postural drainage, okay, for ensuring postural drainage, sitting up is advised. Okay, for ensuring postural drainage, sitting up is advised instead of lying down. Finished. We have used instead of. Here we have used rather than. Here we have used instead of. Yes, just to type in the chat box, please. Anyone. If anything is there, then I'll check through it. At the end, in the question answer sessions, we'll be discussing many things. Yeah. So, if anyone has any doubts, please write in the chat box. Thank you. Right. For ensuring postural drainage, sitting up is advised instead of lying down. Yeah. Yeah, we'll discuss that one later. So, for ensuring postural drainage, sitting up is advised instead of lying down. So you can change these words: recommended, advised, suggested, okay, preferred. Now let us, what's this? Anjana Yadav, Binsi, Blessing, Divya, Kelechi, Kismat, Manjula, Meera, Muthu, Nasra, Neha, Nevin. Nobody is doubtful case. So, yes, okay. Right. Okay. Now let's just take the same thing into another point. Okay. for ensuring postural drainage, comma, sitting up is preferred over lying down. So sitting up position, you can say here. Sitting up position, one more word. Sitting up position. So now I have given three things, preferred over. So now what is this? This is what is the magic of English. You can use rather than, you can use instead of, you can use preferred over. So there are many different ways. I have just given you three different styles. And don't think that only these three things. There are many others. These are enough. These are enough. So here, in these three types of sentences, there is no he, there is no I, there is no you, there is no she. And everything is passive voice only. Is recommended, is advised, is preferred. Everywhere it's passive voice. So is this a very difficult sentence? So when there are so many options, is this a very difficult one? Can you not learn even one point of this instead of three? So today we are going to learn sentences like this. Okay, variation sentences. Learn 10 sentences like this enough. 10 sentences into 10 words, 100 words. Remaining you can write on your own. So now you tell me, are you with me? Shall we learn some sentences like this? Because today's topic is sentence structures. Do you think these are useful? Okay. How useful? Then just if you think that it is useful, say yes. If it is not useful, say no. That's it. If you say useful, we'll move ahead. If you say no, then we'll stop. We'll learn something else. No? Why waste our time for that? Right. Yeah. So many students have said yes. Okay, then we can move forward and we can see some sentences, quality sentences. Okay. Yes. Right. Now here there are some sentences. We will grade these sentences. I'll show you from the same books. There are many samples given. There are many samples given there. This is sentence number 1. Three are samples, but sentence is one and the same. Sentence is one and the same. So what do you want? Why are you doing? So to do this, what you want? Postural drainage is the goal, target, result. So the cause is sitting up position. And avoid what? Lying down position. So more of this and less of this is equal to this. So sitting up position. Yes. Lying down position. No. So less lying down and more sitting up, you can is equal to postural drainage. That is what the doctor is recommending. So this is how you can use the sentences. So this is sentence number 1, 3 different types. So you can use rather than, you can use instead of, you can use preferred over. Okay, preferred over. So rather than also comparison, instead of also comparison, preferred over also is comparison. You are instead of that one, this one. Rather than this, that. Preferring this over that. So all one and the same. So that is sentence number 1. Right. Now let us go again to the book. Yes. Right. So this is William Maguire. Now this is the case notes. We learn some sentences. We don't need everything. We're not writing a letter. We're just making some sentences. That's all. Making some sentences. So here, this is sample letter given by official OET. This is official sample. OET medicine sample response. Officially, they gave the sample letter. I am writing to refer Mr. Maguire, who presented today with a deteriorating respiratory function for assessment and advice on management of his condition. Mr. Maguire was diagnosed with COPD 2 years ago. Now let us see this sentence. Mr. Maguire was diagnosed with COPD 2 years back. This is a very good sentence. This is a very good sentence. Okay. So now let us better to go for Word document. Okay. Yeah. Fine. I am writing to refer Mr. Maguire, who presented today with deteriorating respiratory function for assessment and advice on management of his condition. Respiratory function, for assessment and advice on management of his condition. Mr. Maguire was diagnosed with COPD 2 years ago, period. His risk factors include smoking, for 40 years until 2013, and a relevant family history, sisters with COPD and bronchiectasis. Mr. Maguire has had 2 infective exacerbations of COPD. More than 1 year ago and 3 months ago. both requiring hospitalization and IV antibiotics. Period. He has undergone 6 weeks of pulmonary rehabilitation. Period. He is immunized with Fluvax and currently managed on Spiriva. Spiriva, Seretide, and Ventolin. On examination, Mr. Maguire had signs of hyperinflation, decreased chest expansion, increased resonance, and decreased breath sounds, period. No wheezes or crepitations were audible, period. He has a PEFR of 320 and a FEV1 percentage of 47%. Mr. Maguire's lung function has declined significantly since his last lung function test, FEV1%, 66% in July, period. His daily activities are becoming severely curtailed and he appears to be experiencing mild depression, period. There is no evidence of an acute exacerbation of reversible cause of increasing dyspnea, normal FBC and ECG. Please review and advise regarding the need for potential intensification of treatment and or home oxygen therapy. Okay. Right. Now let us see here. Now let us take the letter as it is, the original version and the transformed version. So I am writing to refer Mr. Maguire, who presented today with a deteriorating respiratory function, for assessment and advice. On management of his condition. Now let us take this one sentence. That's it. That is introduction. So why are we writing 2, 2, 3 sentences in the introduction? I don't know. It's an official OET sample. You can see it there. I am writing to refer Mr. Maguire, who presented today with a deteriorating respiratory function, for assessment and advice on management of his condition. See, how many sentences are there in the introduction? Are there 2 or are there 3? So I am writing to refer. Okay. Now let us take the same sentence, only first sentence. Now if we have taken here already, this is the first sentence, sentence number, okay, 2. Already we have taken sentence number 1 is done. Sentence number 2, how can we modify this? Let us take, this is the introduction. Introduction of the letter. So introduction of the letter. I am writing to refer Mr. Maguire, who presented today with deteriorating respiratory function for assessment and advice on management of this condition. Okay, this is given like this. Okay, what is wrong in this sentence? Nothing. What is there right in this sentence? Everything. Who told this is wrong? And who told this is right? Who told this is okay? Who told it is under low quality grade? Who told it is higher grade? Nothing like that. Nobody told anything. It is your evaluation, your judgment, your understanding, your comprehension. How much you have to implement is all the more important. Right. Now here I am writing to refer. Now let us see. This is official OET. We are challenging the sentence given by official OET with its own statement. Okay. Am I telling that it is wrong? No. Is OET telling that it is wrong? No. No one is telling this is wrong. This is 100% right. But now it's not the point of right or wrong. Doing the right things in the wrong place is wrong, and doing the wrong things in the right place is also wrong. Now here, this is a formal letter, and in a formal letter, personalizations will not be permitted. Now let us see how it is not permitted. Now, I just want to revise you because there may be some 2 or 3 new students who don't know what I am talking because they might not have attended my previous sessions. So just I want you to take to the official OET website or just to type anywhere. Okay, what you have to type, active or passive in the OET, writing and speaking, productive skills. Don't take a edu bench. We don't need that. We want official OET. So check in official OET. So official OET, you go there. Okay. So here oetpractice.net. OET, this is my one. We want official only. OET official. So OET official. Right, here it is. Yeah, let us take that one. So general study tips. Okay. Oh, pattern changed, links changed, everything changed. Ne? Okay. So let us search here itself. Active or passive. Okay. So now you can see here why you should use the passive voice in your writing. OET. So that's it. Okay. So that you can check it later. I'll send you the link later. Okay. So why you should use the passive writing? Here it says, they allow the patient to be the most important part. Passive forms are very common in the formal letters. Very common. Passive forms are very common in the formal letters. Health professionals write because they allow the patient to be the most important part. So now he's telling patient is the most important part. So, but here I am writing, I has become more important than the patient. The patient is Mr. Maguire. So we are handling this sentence with official OET's statement. So that means patient is more important. Who is writing is not important. Patient is more important. So give him the first place. So always start the sentence with right. So now here you see. Yeah. Now this sentence. So what is the danger zone I am writing to? So this is not required. I am writing. Writing is understood, it is redundant. So anybody can understand that it is written. Okay. So I is not important because he is not the patient. So Mr. Maguire is the patient. So start with Mr. Maguire. Okay. Start with Mr. Maguire. So the full name is Mr. William Maguire. Okay, let us check. Many people think Mr. William Maguire. But what is given here? Mr. William Maguire is not given. Mr. Maguire, that's enough. So take only the second name. Don't take the first name. Take only the second name. Yeah, good evening, Mr. Noor. So take only the second name. Only in the subject line, write the full name. Afterwards, take only the second name. So Mr. Maguire, see here, Mr. Maguire. Mr. Maguire, Mr. Maguire, Mr. Maguire, Mr. Maguire. In every paragraph, Mr. Maguire is there. Okay. So it is not necessary to put because it will be easy for ordinary students. So they gave in an easy style. Because question papers, books will be printed in such a way that it will be useful for everyone. So if the quality is extraordinary, A grade quality, then everyone cannot follow. So that's why they'll make it simple. Easy, they'll make it. Okay. So based on that one, everyone can learn at least something's okay. If it is not A grade, at least B grade they will learn. Na? So that's why they will give B grade only. They will not give A grade qualities things, everything in the books. Because books will not be sold, books will not be, purchased. Many things are there for that one. So reaching more people is more important here. You understand? See, if I give ordinary quality, everyone will run to me. You understand? So that means available to each and everyone. That will be ordinary. So what is our, see for example, let us take a phone. A phone. Ordinary phone is there in everyone's hands. But extraordinary phone is there in few hands. So like that one, same thing. So here, if you give ordinary, more people, so more business will be there. So that is why they will be available to each and everyone. That's why they are preparing like this. But okay, so try to improve on these lines. They have already given that. So no need to say Mr. Maguire everywhere. Don't raise your hand. If anything is there, you just type in the chat box, please. Okay, chat box, because everyone will get disturbed. So put your hands down. Type in the chat box, please. Anybody? Right. Now, because the lecture is going on, don't flow in the middle. Afterwards, we have the question answer session. You can definitely ask me. So now let us see here. Mr. Maguire, Mr. Maguire, Mr. Maguire, Mr. Why is it needed, Mr. Maguire? It is already told here, Mr. Maguire. Then why again and again? Huh? See, for example, if you go to a supermarket, name of the supermarket will be there in the beginning. Then everywhere, you need not write the supermarket's name in the inside also. If you go to a bank, for example, bank name will be in the beginnings. State Bank of India in the beginning. Then inside, State Bank of India manager, State Bank of India cashier, State Bank of India accountant, State Bank of India watchman, no need. So whatever inside is State Bank of India only. So again, everywhere you need not say State Bank of India, State Bank of India, State Bank of India. No need to say. Just say manager, that's all. Cashier, that's all. Accountant. You have to understand that. So in that letter, when your subject is Mr. William Maguire, that means everything is related to Mr. Maguire only. So why again Mr. Maguire, Mr. Maguire, Mr. Maguire every time? So that's, you have to understand that one. You have to understand that one. Okay. People who lack that understanding, they will tell many different things. Don't just believe. Go to the official things and learn. What is this subject regarding Mr. William Maguire? That means this letter is regarding Mr. So that means every sentence is regarding Mr. William Maguire. So why do we need to tell? That's it. So here Mr. Maguire and COPD too. So the doctor diagnosed COPD for Mr. Maguire. So Maguire was diagnosed, COPD was diagnosed. But now which is important? In this sentence, which is important? In this sentence, which is introduced newly? I want to ask you now. In this particular sentence, Mr. Maguire was diagnosed with COPD 2 years ago. So what is the new thing that is introduced in this particular sentence? What is introduced in this particular sentence? What is the new thing that is introduced? What is the main topic in this sentence? Is it Mr. Maguire? Okay. Or is it COPD? What is the thing importance here? What is the introduced new one here? Maguire is already introduced here itself. So why should you make him the subject of the sentence? Why do you want to make Maguire as the sentence? Because Maguire is already there in the beginning only. So straight away you can say COPD was diagnosed 2 years ago. Now that is one sentence. So you can say 2 decades ago. I will tell, I don't say 2 years ago. Sorry. 20. Okay, if it is 20 years ago, it is 2 decades ago. So it is 2 years ago. Right? So 2 years ago, COPD was diagnosed. Why should I want to write one word extra, Mr. Maguire? Yeah, because I'm talking about Mr. Maguire only. Did I introduce anything new in between? Why should you get confused? Am I crazy? Or are you crazy? Or anybody crazy? It is already introduced. We are the main subject of the total letter is Mr. Maguire. Then why should I tell Mr. Maguire every hour now and then? So just to tell, 2 years ago, COPD was diagnosed. Finished. So this is how you improve quality. Right. Now let us take this sentence. So I am writing to refer Mr. Maguire. So this is a referral letter. Okay, this is a referral. Who presented today? Who presented today? Today is present tense. Presented is past tense. Today is present tense. Presented is past tense. So he could have said presented today, no, presented today morning. So morning when finished. Now it is afternoon or evening. So it will be presented right. But who has presented is better. This is also correct. Who presented today when at 8 o'clock in the morning, but that is hidden, only today is there. So there is a confusion. Is it today means present tense, presented means past tense. Present tense and past tense, they don't match. They don't match. There is some sort of confusion here. It may be from OET, but confusion is definitely there. Today means present tense. Who presented yesterday will be fine. Who has presented today is fine. Who has presented today or who is presenting now. So that's fine. Who presented today? So when you're saying today, day is the factor. Yesterday is past, presented yesterday. Tomorrow he will present it. Today he has presented. So that is how you can improve the quality. Right. Mr. McGuire, who has presented today or who presented this morning. This morning you can say. Morning is finished. So past tense, who presented this morning? This morning. Now it is afternoon or evening. So that's how you can differentiate. So who has presented today? So that's absolutely 100% right. Or who presented today morning or early in the morning? Morning is finished. Now it's afternoon or evening. Who has presented today with right. So Mr. McGuire, who has presented today with the dash dash dash, is being referred for, okay. Now is being referred for what? For assessment. Now who is writing this letter? Who is writing this letter? To whom is he writing? Department of Respiratory Medicine. And who is writing this letter? A doctor is writing. Okay. So assessment is needed. For assessment and advice on management of his condition. So let us take the case notes here. Now respiratory function with significant ADL, lower and reduced respiratory function with significant reduce of in activities of daily living, mild depression. Okay. Now here, refer to respiratory specialist for assessment. So now I assessed something. I might say, doctor, I assess it. But a definitive diagnosis, you can say, or further assessment. So you can say like this. So I'm changing, is being referred for further assessment, or you can say for a definitive diagnosis. Okay, or for further evaluation. So write however you want, change, modify, and write is referred for further assessment. Now here, now I'm telling you, assessment is there, but in the case notes. Yeah. So now assessment is already there. Assessment is already there. So why do you want to use the same word assessment? Why do you want to use the same word assessment, which is already, it is not your word. So change it to evaluation or diagnosis. Further evaluation and advice on management. Advice on management. And suggestions and referred for further evaluation and recommendations for, instead of advice I'm saying recommendations or suggestions. recommendations on recommendations regarding appropriate management of his condition only. It's not somebody else's condition, right? So let us put a full stop here. Mr. Maguire, who has presented today with deteriorating respiratory function. Yeah. Deteriorating respiratory function. Okay, so Mr. Maguire, who has presented today with deteriorating respiratory function, is being referred. The word refer I have used, but here it is active word, but being referred here is passive voice. Refer is active voice. This is a danger zone. We used passive voice here. Is being referred. For further evaluation, change the words. Assessment is changed to evaluation. And management also you can change according. Okay. So, right. Next. So you can write different styles, not just this one. So I have shown you one. So there are many other ways how you can write. Same thing. Same thing. You can write in many different ways. First write this one and then the purpose. So what is the reason and then the purpose. So deteriorating respiratory function is the background. So referred for further evaluation and recommendations regarding appropriate action plan, follow-up action plan. So it's appropriate follow-up action plan or action strategy. Anyway, you can write. Only the thing is you should know how you are going to write. So management, advice on management, appropriate follow-up action strategies. See how modified. Right. Then next, the same thing in another way, how you can write. So refer, let it be in the first introduction itself. Don't take it in the last. Yeah. So Mr. Maguire, who has presented today with the deteriorated respiratory symptoms, is being referred for further evaluation because assessment is there in the case notes. We removed and written evaluation. Okay, now the same thing, how can we modify into another style? Okay, this is a very ordinary style. This is a B plus style. This still even improve. Okay. Right. So you can say with symptoms suggestive of. Okay. With symptoms suggestive of. Or who is preliminarily diagnosed with. See, however you want, whichever is possible, you can write. Not necessary that all are correct. Some things may be right, some things may be wrong. Is being referred for the definitive diagnosis. A definitive diagnosis and appropriate suggestions for appropriate suggestions for managing the condition. Appropriate suggestions or necessary suggestions. Okay. Or suitable suggestions for managing the condition effectively. However you want to change, you can change. Think how well you can write. What are the most important things that should be there are these things. Mr. Maguire must be there because this is the introduction. Then next one is presenting, not admitted. Okay. The next one. What is the background story? What type of letter is this? And what does he require? This is the purpose. Okay. Diagnosis. A definitive diagnosis is required. And management. This is the purpose. So these are important. Others you can change and play whatever you want, but these things must be there. Maguire will not change, present will not change, deteriorating respiratory function will not change, refer will not change, diagnosis will not change, management will not change. Everything else will change. All right. Now let us see. So those who want to improve your quality, just improve. This is second sentence. Now let us take the third sentence. Third sentence. Okay. Right. Now here is the third sentence. Mr. Maguire was diagnosed with COPD 2 years ago. So Mr. Maguire, Mr. Maguire, Mr. Maguire, every time why? Okay. So you can just say, start with 2 years ago. Whenever time is there, you bring it to forward. 2 years ago, comma. Whenever you are bringing a phrase to the forward, you have to put a comma. 2 years ago, comma. 2 years ago, COPD was diagnosed. Finished. For whom? For Mr. Maguire only. You don't understand? No problem. Oh, how will the reader? And the reader is not a crazy fellow. He is not mad. He is lot of knowledge. If he says, I don't understand who was diagnosed with COPD. Subject, what is the subject? Maguire. That's understood. 2 years ago, COPD was diagnosed. Now, I want to ask you the same sentence. Can we write like this? 2 years ago, COPD has been diagnosed. Now we are coming to critical thinking. Now, which sentence is correct? You think. Now, sentence number A. This is sentence number A. This is sentence number A. This is sentence number B. Now you think which sentence is correct in this? Two things. And you have to give me the reason why also. Now, which is the sentence, correct sentence, and why? Now, my question is, which sentence is the correct one and why? Yeah, come on, write in the chat box, please. Write in the chat box. Okay. A is correct or B is correct and why? Why A is correct? Why B is correct? Just A or B is not enough. Tell me why it is correct. There are many people who are teaching wrongly these things. Okay. Has been also finished and was also finished. But was is finished in the past, has been is finished in the present. That's all. That is also perfectly completed. This also perfect tense means what? Complete. Okay. Yeah. Now, how do we know is 2 years ago. Ago means before, not now. So was is perfect. Because ago means before, not now. Before, now, after. So this is the division. You should know that. So before is past, now is present, after is future. Now it is very clear for you. And has is present. If you say this year, then COPD has been diagnosed. That's fine. Okay. So diagnosis, okay, COPD is still he has Divyamol. That is not our problem. He has a COPD is not our problem. Diagnosis is the problem here. We are not saying he has been, he is having diagnosis. We are not talking about tense is not related with having COPD. There is nothing called have. Okay, you are saying, what is that you are saying? He has COPD, but where is the verb has here? Where is the verb has? There is no has. This verb is diagnosed, and you are bringing a new word has. Has is not at all there. Has means present tense, but where is the word has? He has COPD means present tense, but where is the word has? Okay, where is has? See, he has a COPD, still he has COPD, that is different. But in this sentence, there is no has. There is no has. No, sorry, Anjana, has been means it will still continue. No, 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 no. It is not continuing. Ing means continuing. Where is the word ing? You are also wrong, Anjana Yadav. Continuing means ing form should be there. That is continuous. He is having COPD. That is continuous. He is having COPD means continuous. That is doesn't match. Sorry. So ing form should be there. Ing form. Where is ing form? You are saying continuous, but it is not continuous, Anjana, because there is no ing form here. There is no ing form. Yeah, you have to understand. You are with the grandmaster here. You have to understand. There is no question. Here, if ing form is there, it is continuous. So you should know what is past, what is present, what is future. So that's it. If ing form is there, then only continuous. So there is no question of continuation here. And a diagnosis is not continuing. Diagnosis is not continuing. Diagnosis is a one-shot go. Within a second, you will diagnose. That's all. First, you will test, and he'll say, yeah, COPD, finished. How much time do you need? Diagnosis is not continuing. COPD is continuing, but diagnosis is not continuing. Diagnosis is a 1 second action. That will be finished in 1 second. 2 years ago means past. You cannot take it to present. So that is why B is wrong. Because ago is a word which is called a pointer to past tense. Ago means what? What do you mean by ago? That you don't know? So ago means, yes, you should know the word ago. Ago means back in time from the present. That means not present. Back in time from the present means past. So how can you use has been? No way. So is that clear? So there are some words which tell you they are called as pointers of time. pointers of time. Now, pointers of time. So many people lack this one. Pointers of time. Now let us identify all of you. Okay. Yeah, history he has. Okay, he has it. That is correct. That is correct. He has had a history of COPD for about 2 years. So when you say he has had, okay, history means history only. Yes, that is right. Has a history is right. That's fine. History, now he has a history, but earlier he had, now also he has. Okay, then we'll think about another stage. Next one is pointers of time. What are the pointers of time? See, I told you before, now, after. Before, now, after. Now I'm going to show you the pointers of time. Now present tense, past tense, future tense. Present, past, future. Okay, now let us see here. I told you already, this is present today. Okay, so what we have to do is here we have to make past better. Present. So present is today. If today is present, yesterday and day before yesterday, everything will be past. Yesterday is past. And tomorrow is future. That's it. Okay. And here, now, then. Okay. Now, then. Here also then. Then means that time. This now means this time. Then means that time. That time in the future, that time in the past. The same time in the future. The particular time in the, so here, a particular time in the future. A particular time in the future. Yeah. Then means a particular time in the past. So that's it. Right. So this is the way how you use past pointers. Now let us see simple past tense. Simple past tense. Simple past tense means what are the words which will come? Just you have to use simple past tense, nothing else. So ago, before, in the past, earlier, previous, the previous day. So these are called pointers. They will tell you which tense you have to speak. Ago, before, in the past, earlier, the previous, the prior, the earlier, the previous, the prior, ago, before. These are the words which tell about the past. And what about the future? In the future, after, in the future, the later, the next, the following, okay, the preceding year, preceding. So future will be the succeeding. The earlier, the previous, the later, okay, the following, the next, the later, the next, the following, the succeeding. So this is future, this is past. These words are there, that means you have to use past. Now it's very clear here, you can see in the case notes. So 2 years ago, 2 years ago, so definitely was diagnosed, not has been diagnosed. Definitely was diagnosed because ago is there. So simple past tense. That's it. Okay. So you have to be very careful which tense you have to use. So here you cannot use present tense. You cannot use present tense. You have to use past tense only in this sentence. Next one. See here. Has had two infective exacerbations. So that's fine. Right? So now he is immunized. Okay. Has means present tense. Had means past tense. See here. Had means past tense because of time factor. This everything related to time. So come on. Now here. Mr. Maguire was diagnosed with COPD 2 years ago. Finished. Now, the first one is the right option. So COPD was diagnosed 2 years ago. 2 years ago, COPD was diagnosed. So 2 years ago, this time, bring it forward so that they will understand, okay, like easily. So 2 years ago, COPD was diagnosed. Finished. Simple. So why to unnecessarily waste two words? Mr. one word, Maguire another word. Two words you are wasting simply. They are no useful because it is redundant. Redundant means more than necessary. Right. So now be very careful when such words come. Ago, that is going to help you. That is going to help you. Ago is there. Today. Today means present tense. Remember, I'm telling you, I'm giving you the hints now. Whenever today is there, you have to use present tense. Okay. Whenever ago is there, you have to use past tense. No doubt regarding that. Right. So that's very clear. Next. Third sentence. His risk factors include. Yeah. There are two things here. This is, you can make this instead of commas, you can make it a list. You can make a list and you can put semicolon here. That is making list. So it's list finished. Okay. His risk factors include. Why do you want to say his? You can say the risk factors include. The risk factors include. Just you can, okay. So this is one sentence. This is sentence number 4. So as it is. So sentence number 4. This is sentence number 3. Third sentence, and this is fourth sentence. Okay. Right. So his risk factors include smoking for 40 years until smoking for 40 years until 2013. Relevant family history, sisters with and a relevant family history. Sisters with COPD and bronchiectasis. Okay. Now here, his risk factors include smoking for 40 years until 2013. Now, smoking for 40 years, smoking and a relevant family history. Okay. Now, you can separate this one into two parts. One is personal and one is family. One is personal history and one is family history. Okay. So you can write it into two different sentences. If you cannot bring this one, this is a very high grade sentence. This is A grade sentence. This is A grade sentence. But if you cannot write like this, break it into two parts. Okay. This can even be increased and made listing. So, smoking for the past 4 decades. Okay. Smoking for the past 4 decades. Smoking for, not past, smoking for smoking for 4 decades. Smoking for 4 decades. 40 years, 40. Not past 40 years. Past 40 years means in between something is after 2013 he did not smoke. Until 2013 he smoked. So smoking. Okay, quit 5 years ago. That is it. So here I'm changing into a high grade sentence. Quit 5 years ago. Okay. Prior to smoking cessation 5 years ago, prior to smoking cessation 5 years ago, prior to smoking cessation 5 years ago, smoking for 4 decades has been informed or reported, recorded, registered. Okay. Prior to smoking cessation 5 years ago, smoking for 4 decades has been registered, noted down in his case story. So that's it. You see here, this was not there. We brought it forward. So when you are breaking, try to improve the quality then, still even. And 40 cigarettes per day. 40 cigarettes per day, that also can come here. Smoking, regular daily consumption, regular daily consumption of 40 cigarettes. Remove smoking. Consumption of 40 cigarettes means smoking only. Prior to smoking cessation 5 years ago, prior to smoking cessation 5 years ago, regular daily consumption of 40 cigarettes for 4 decades has been registered. Finished. See the quality of the sentence. You don't know how to expand. I'm showing you how to expand. You say, sir, we are not able to. We are not able to write very nicely, sir. How can we? There are 2 sentences in this one. I broke into 2 and I'm taking only 1 sentence and I'm expanding. Okay. Before quitting smoking, again the same sentence, I'll write in another style. Before, prior to, I'm removing prior to and saying before. Before smoking cessation. Before quitting smoking. Okay, 5 years ago. Before quitting smoking 5 years ago, I'm changing. Everything will be changed, no problem. Before quitting smoking 5 years earlier, 5 years earlier, he quit smoking. Before that one, okay, smoking 40 cigarettes on a daily basis for 4 decades has been notified. Total sentence itself changed. We can write 10 different, 100 different ways. There is no problem. Okay. How you are writing is important. Now write a sentence, a relevant family history. We'll write about a relevant family history. Sisters with COPD and bronchiectasis. That is another sentence you can write separately. So how to expand a sentence and to how to concise a sentence. Where it is becoming more, you should concise. Where it is becoming small, you should expand. I'm going to ask you one question. I'm going to ask you one question. Is the lecture useful for you? Just I'm giving you 30 seconds to respond. Give the reasons. First say, is the lecture useful for you? That is the first question. Then you say why. Then you say why. Why it is useful also you have to tell me. Otherwise there is no meaning. Simply I am bak. Huh? Give me 2 minutes, please. Write down your answer. I'm giving you 1 minute. Write down your answer, why it is useful. Yes. Now I'm going to give you some sentences. Get ready, get up. So now you understood. So now I'm going to give you some basic sentences and I'll teach you how to improve those. So 100 basic sentences. Today we'll learn very fast. Right. 100 basic sentences. Right. Hundred basic sentences. Yeah, get ready. I'm going to tell you. So think about these things. Whatever sentence I'm giving you, write another sentence. Okay, how many of you are going to be active? So activity participation is needed. If you are not very active, then I cannot help you much. So those who are active, those who are going to be active, sir, you write one sentence, we'll write another sentence in the same style, changing name, changing everything. This is called guided learning, guided learning. Somebody is telling you something, you follow the same path, changing everything. Okay. For example, if I say, Hari is a boy, then you will change everything like, yeah, Radha is a girl, like that. So you have to change as many as possible, change everything and write a new thing totally without copying anything from me, like that. So that is called guided learning. How many of you are ready for that one? So those people who write two names, first name and second name. So others I will not bother, because what I should tell, I cannot force anybody. No? So those are willingly volunteering to participate in the active session, dynamic brainstorming session. So type your first name and second name. Yeah, Dr. Muhiba. Very good. Next, write your first name and second name. Neha Nevin. I'm going to give you wonderful sentences. Yeah. Yes, there are many participants. Very good. Thank you very much. Okay. Yes. Ready. I am not stopping. You are not stopping. Nobody is stopping. Just we are moving forward. I will write one sentence. You write similar sentence. Don't bother about anybody in the world. Don't bother about anybody in the world. It is you and I. That's all. Nobody else. You and I and nobody else. Now, so whatever I am telling you, change and try to improve the sentence and write. Okay. Now, Number one, sentence number one. I am writing to refer Mr. John, comma, 54 years old man who lives alone. I am writing to refer Mr. John, 54 years old man who lives alone. There are mistakes in this. I'm just giving you one sentence. I am writing to refer Mr. John, 54 years old man who lives alone. Write in your own style, whatever you want. In this, mistake is there. This is wrong sentence. This is incorrect sentence. Actually, this is incorrect sentence. Incorrect. Now correct it, and this is incorrect sentence. You can correct this sentence. I am writing to refer Mr. John, 54 years old man who lives alone. Write whatever you want to write, you write. However you want to write, you write. This is a wrong sentence. First write in your notebook, then you can write in the chat box. There are many mistakes in this one actually. It is correct sentence, but there are some mistakes. And quality is very low. So you can correct your own sentence, you can write your own sentence, what. Okay, but when you are writing, write number one. When you are submitting, write number one, because it is related to question number one, that's all. So your answers, please. Yes. So here comes your answers, your corrections. Rewrite the sentence. Rewrite the sentence with necessary corrections. If there are corrections, if present, if mistakes are there, rewrite the sentences with necessary corrections or improvements. Correct them or improve them with appropriate improvements. Okay, that's enough. Necessary corrections or improvements. So that's it. Now, next one. I am writing to refer Mr. Harry Douglas. He is 81 years old. He is a pensioner. He is a widower. He requires dietary advice after undergoing liver transplant. I am writing to refer Mr. Harry Douglas, full stop. He is 81 years old. He is a widower. He requires dietary advice after undergoing liver transplant. However you want to write, you write. I don't mind. Take your chances. Okay. Take your chances. For all the questions, write number 1. For first question, write number. Otherwise, I cannot identify your question. Na? I cannot identify your question otherwise. So that's it. So whenever you are writing any sentence, write the number and post. Without number, I'll not even bother. So all these numbers I will take them, okay. I'll take them like this. So select all, copy, and I'm going to take them like that. All your sentences here like this in a new page, and I'm going to correct them as far as possible. Don't think I expect everything I can do, please. So like this, I'll correct like this. Track changes. Reviewing. Okay. This is to refer Mr. John, a 54-year-old man, comma, who lives alone, full stop. And after full stop, there should be a space. Okay. That's it. Then Elizabeth, that is Divya. This is to refer Mr. John, a 54-year-old man who lives alone. Very good. Mr. John, comma, 54 hyphen year, no S, hyphen old man. Okay. 54-year-old man, comma, who lives alone. Okay. Is being transferred. Dot, dot, dot. Okay, very good. Mr. John, a 54-year-old man. Mr. means man only. Then why this man is this man required? Is this man required? Mr. means what? Man, not a woman. It's understood. So is this word man needed? Is it needed? You can straight away say 54-year-old John lives alone. Like that. So you have to be a little careful why it is redundant, why it is. This is also right. I'm not saying it is wrong. It's right. Grammatically, it is right. But man is not necessary because Mr. is there. Mr. John, who is 54 years old, lives alone. Finished. Right. Mr. John, a 54-year-old man. Comma, who lives alone, is being referred or will be referred to you. Okay. Will be referred to you only. Why? Not necessary. Right. Mr. John, 54 years old. Mr. John, who is 54 years old, stays alone. Okay. So this you can put brackets and adjust something. Is being referred. Okay. Who is 54 years old and stays alone is being referred. So whatever, however you want to say. So continuation. So like this, I'll give you corrections whenever possible, however possible. I cannot give all, but as far as possible, I'll try. Otherwise, you also can learn some things. Just at least try, no, afterwards, when I'm correcting, I'll correct. So this is second sentence. And the third sentence is, I am writing to refer Mr. Mason, full stop. He is due to be discharged today. He has made a full recovery. I am writing to refer Mr. Mason. So this we can write in fourth sentence. Okay, I'm writing to refer Mr. Mason, 70 years old, who lives alone. So mistakes are there, correct the mistakes, basic sentence. Rewrite the sentences with necessary corrections or improvements. Okay. Many people will think Simon sir has given wrong sentences. These are your activity here. Yeah. So mistakes are there, correct. That is your duty. I'm giving you some sentences, that's all. And next sentence. Dear Miss Dan. Okay, this is not needed. We can straight away say, I am writing to refer. These are common sentences written by common people. So those only I'm giving you change. And I am writing to refer. If you want to write, you write like that. If you don't want to write, remove. Okay, active voice, passive voice, whatever you want to do based on your learning, try to use. I am writing to refer Mrs. Redford, an 74-year-old woman. All are mistakes there, okay? Who is a resident at the Sunrise Retirement Home, who needs urgent admission to your hospital due to severe stomach pain. Your wish, how you want to write, you write. I don't have any problem. I'm giving incorrect sentences. So correct those sentences, that's all. However you want to write, you can write correct. Yeah, I am writing to refer Carlson, a 13-year-old boy who is a year 7 student at Williams School. I am writing to refer. Write in your own style, however you want to write, you write. I am writing to refer Mr. Ernest DeCruz to you, an 62-year-old widower. He is due to be discharged today. He has made a full recovery from asthma. Yeah, Relaxedly write your words, sentences. Write down your number, Neha. Okay, otherwise I cannot identify. Next, thank you for admitting Mrs. Stewart. Thank you for admitting Mrs. Stewart, comma, and 70 and 70-year-old and 70-year-old and 70-year-old dementia patient and 70-year-old dementia patient requires respite care for a period of 3 months. Okay, now I'll give you some sentences. They may be right, they may be wrong. If it is right, wrong, correct it. If it is right, also improve it. Okay. Miss Merkel was admitted to our hospital on the 30th of October. with a diagnosis of right rotator cuff tear following a fall while descending stairs. Try to write in a different style. Some sentences are correct. Miss Merkel was admitted. Miss Merkel was admitted to our hospital on the 30th of October with a diagnosis of right rotator cuff tear following a fall while descending stairs. It may be right, it may be wrong. Improve the sentences. Therefore, she has been suggested. Therefore, therefore, sorry, surgery has been suggested. Therefore, surgery has been suggested. Therefore, surgery has been suggested. However, she prefers non-surgical treatment. Avoid she. So, however, non-surgical treatment is preferred. Finish like that. Try to modify as far as possible. And two more sentences I'll give you. She received. She received. She has received ibuprofen. Ibuprofen or ibuprofen. And cortisone as prescribed, and also daily visits by a physiotherapist. Okay. So last sentence. Yes. So I'll copy these sentences and post in the Telegram channel. You can try and you can write. Okay. I have a little bit of stomach pain, so I have to take leave. Okay. So I need some rest. Okay. So thank you very much, all of you. Good night. You can write in the group or send them to me personally.